I woke up in the hospital. After I found out, it was sort of in shock that it happened to me.
When my voice went, I was slurring, and I've seen other people that had strokes, and then I realized, I knew that's what was happening then.
Well, the American Heart Association and the American Stroke Association have all come up with guidelines, best practice guidelines. And in having those guidelines that are research-based and evidence-proven, we're able to practice state-of-the-art medicine here in our hospital as well as across the country. And it's fairly consistent if everyone follows the same guidelines. So it really allows us to provide the best possible, most timely care that we can for our patients.
It was just a normal day. My son was there and my wife, and he decided we should do a little cleaning in the garage. And he went upstairs, and I was going to move some other things into another garage, and I got in the doorway, and I got real dizzy to a point where I didn't want to move. I called for my son. He came down into the garage and I told him, I said, there's something wrong with me. I said, I can't move. I think I'm going to fall over. I'm real dizzy. My voice went, and he called my wife, and I said, I'm having a stroke. I could tell by the way my voice went and stuff like that. Then I was having a hard time breathing, and it got to the point where I told her, I think I'm dying. My son said, call 911 right now. They got me over there. I had the doctors and stuff, I could check me out. They were putting stuff into me. Everything started coming back within an hour or so, stuff like that. My voice come back. It just don't come back, to where I seemed normal in that. I didn't have to go to therapy or anything like that. I did go back to my family doctor, and he wanted me to stay off work, for some time, but which I did. I eventually went back to work, and it just seems like everything's, back to normal. I'm doing everything that I did before.
I think we just got done eating, and I was on the computer talking to Josh.
The conversation just stopped.
Whenever my brother called, I knew that there was something definitely wrong. Just in his voice, there was just something, hey, go check on Dad, and it was definitely, hey, you need to go down right now. As soon as I walked down the stairs, I could see him hunched over in the computer chair. He had this horrible ashy color, and he had agonal breathing.
And I was like shocked because I didn't know what was going on, and I got on the phone with 911 to get everybody to come.
From that time on, I remember pulling my dad from the chair and starting CPR, which, being a nurse, you do CPR on people and you don't really think about it too much whenever you're at work, but doing it on your own family, that's a whole nother game.
Please let them get here fast and let them get in the house to help her, because she was doing CPR for so long and I could tell that she was tiring.
Fire company got here first. By that point, we shocked him at least 3 times by the time the ambulance got here, and we got an IV in him, loaded him up, and took him to Miners.
Once they stabilized me at Miners, they flew me to Conemaugh, and then when I got there, they put 2 stents. Dr. Stenberg put 2 stents in.
By the time we got there in a half hour, his procedures were already done.
All I remember is talking to him. From that point on, I don't remember anything until Friday afternoon sometime, the next day. The days up, before this, no, I didn't really have anything. No signs, no symptoms. Just maybe being a little bit tired.
I'm extremely honored. I have been practicing emergency medicine for over 30 years. I've seen medical care advance dramatically. I've felt very honored to have been part of some of those changes. It's nice to see them roll out, and it's obviously nice to be appreciated. Probably most gratifying for us in emergency medicine is that we get to impact patients' lives at times where they really need help. Patients, when they're really in life or death situations, we get to be there and intervene and hopefully help them through that. And cardiology, obviously, and stroke are very big parts of that, because heart attacks and strokes can be extremely devastating and sometimes lethal problems. And if we can positively impact patients in any way, shape, or form, it's really gratifying for us, and that's why we practice emergency medicine. The best way to treat yourself regarding heart care or stroke care is to live a good, well-balanced, clean, healthy lifestyle. It's much better to prevent a stroke or a heart attack than it is to undergo treatment for a stroke or a heart attack.
My wife, she's kind of like, trying to watch what I'm eating, and things like that. And that's another thing too is, with the grandkids and stuff, I want to, try to be around, as they grow up and that, possible. The biggest thing is you got to call 911 no matter what. I mean, if you're alone or whatever, you just can't, put it off. You got to do it if you want to, try to get better or possibly not die or be crippled for the rest of your life and stuff like that. So I think you got to hurry up and make the call.
So if you think you may be having a stroke, time is of the essence. Call 911, have them take you here to the hospital so we can treat you as quickly and effectively and efficiently as possible.
If you have any symptoms, you don't feel right, maybe tell somebody. Don't keep it to yourself.
It's very important that if you feel as though you may be having a heart attack, if you have really significant chest discomfort or jaw discomfort or significant difficulty breathing, sweating for no known reason, then really you should call 911 instead of trying to drive to the hospital yourself.
Take a CPR class and pay attention while you're there, because you never know when you're gonna use it.
I'm glad she was able to do that and be able to handle that for the time that she did it.
I know it's hard and it's not fun, and I know that I have training that maybe helped me do it, but that little bit of CPR could save someone's life, and I'm forever grateful for what I did to have him here.